My name is Megan McDonald. I'm a certified nurse-midwife, and I'm practicing at Community North Hospital. So a lot of people just think about pregnancy when they think about a certified nurse-midwife, but we can actually care for women through the lifespan. So starting in puberty and then even through menopause, we can help women with all kinds of hormonal balancing, birth control needs, UTIs and infections, and we can also do, of course, preventative care. So annual exams, pap smears, annual testing, we can do all of that. So at an annual exam, we can do age-based screenings. So for the pap smear, usually that's about every 3 to 5 years unless you need it more often. We can do colonoscopy screening, order mammogram, and then we can do lab tests based on your medical history and other things that might become risk factors for you. So a pelvic exam, some people get that confused with a pap smear. So a pap smear is part of a pelvic exam, but really a pelvic exam, we are looking with a speculum, and then we're also doing a bimanual exam where we feel the uterus, we feel the ovaries, to feel for any masses or anything else that might be causing issues. And in addition to that, we can do the pap smear if it's appropriate based on age and recommendations. And the pap smear is actually a cancer screening. On the pelvic exam, we can test for any masses, any abnormalities by feel, and then we can also look with the speculum and sometimes see abnormal discharge. We can do the pap smear or any cultures as well. The pap smear is a cancer screening, and we can also test for HPV, which we have found makes you much more likely to develop cervical cancer. So we do that typically starting at age 21, and we can do it every 3 years in your 20s, and then every 5 years if the HPV is negative after age 30. If you have an abnormal, then that would change how often you would we would recommend you getting it done, but typically every 3 to 5 years. What we're looking for is cervical cancer, mainly, and we also are testing for HPV, which we do know can cause cervical cancer. So we look for both of those on a pap smear. If we are able to find something early on in the process, the prognosis a lot of times is much better for patients. And so early detection can really save lives because we can start treatment a lot sooner. Sometimes we can even identify things before they start by just finding out your risks. And so if your risks are elevated, we can maybe talk about things that might prevent different issues that might arise. And that's why it's important to come for annual exams, even when you're feeling well, because it is preventative care. If someone would like to schedule an appointment with me or any of our exceptional providers at Community, they can schedule online at ecommunity.com/FAD or by calling 317-621-2727. You can also schedule an appointment with your established care team through MyChart. If a patient is nervous about coming in and being seen, I would encourage them to go ahead and make an appointment and think about what would be important for them to go over with their provider. We want to meet you where you're at. We want to give you individualized care. And so if there's a test you don't want to do or a procedure that you'd rather wait to do, don't let that stop you from getting the care that might be really important for you at this time.